Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal-Sentinel.
Brittany Keyes of Beloit is a Democratic candidate in the 31st Assembly District. Brittany, welcome to WisconsinEye.
Steve, thank you for having me here.
You're a first-time candidate, so I'm just curious. You're into new experiences, and what do you consider the most important issue in your campaign, Brittany?
I would say that healthcare is the number one issue that I see in my district and within my campaign. So I'm a doctor of physical therapy.
You are.
And I worked in the clinic this morning. Yeah, and so I see on a weekly, if not daily basis, the issues involved with the burden of cost increasing, patients not being able to get the care that they need, and also with looking at the broader picture, the concern of the national protection of pre-existing conditions, and the potential of that being taken away. And as I go throughout my district and talking to voters throughout the district, that is a very large concern.
Okay.
So, I mean, I would argue that 80–90% of us have pre-existing conditions, and if that was polled, we could all be priced out of healthcare. And so, being able to put the right recipe of people in Madison that can support folks being covered and having pre-existing conditions covered is very important, and really applies to people throughout and across party lines, and no matter what your age is.
What's your thought on how to preserve and maybe expand healthcare in rural areas? Now, you largely an urban area, but what's your thought on rural areas, please?
So, as far as expanding healthcare in rural areas,
protecting and potentially expanding, any thoughts on the unique needs of rural areas?
So one of the areas that I know that they're currently working on is telemedicine, so being able to reach folks in more rural communities. I also think we need to do more to recruit and retain physicians.
Is it the job of state government to do that?
I think it's a team effort as far as retaining and recruiting physicians,
yeah.
and broad health care. It comes back to the student loan debt crisis.
Okay.
I have numerous friends who are physicians and young physicians, and it's not uncommon for them to have upward of $400,000 worth of student loan debt.
That's a lot of digits. 400,000. Yes. It's a lot of zeros. Excuse me.
Yeah. So. If the average student coming out of a four-year college, it has about $30,000 to $40,000 debt. But when you get into graduate school and professional, become a medical professional, those numbers go up quick, and it makes things very challenging. In addition to the student loan debt crisis, their work's long hours. Again, this is not the role of the government, but I know that young physician burnout is a concern as well.
Okay. State government and Delta Dental have a program that subsidizes dental care in medically underserved areas for low income. Should that be a priority in the next Medicaid budget? I definitely think that looking at dental services should be a priority, especially when looking at services in Walworth County and our rural communities. Dentists, I believe there was only one dentist in all of the Walworth County region that accepted Medicaid. So that leaves us with a huge need, and yes, I feel that should be a priority. AARP raises the issues of caregivers. They estimate 578,000 Wisconsin residents are caregivers. So here's my question. Would you support laws or regulations that require hospitals to recognize and work with family members who are caregivers when someone they love is hospitalized? So, as a healthcare professional
Yes,
that has
you are a
worked-
healthcare professional that deals with some of these.
Yes, and I've worked in several hospital settings. I would say that at present, that the hospitals and healthcare providers definitely work with the families and the caregivers. That's part of the multidisciplinary approach. That's part of the way that hospitals and health systems are to address patient needs. So I don't know if there is an additional need from the state. That's something I'd have to look more into,
understand.
right?
Okay.
But it's from my position, I feel that that's something that is being done. Of course, it can probably always improve.
Final question on healthcare, I promise. Should the state apply for the expansion of federal funds to expand Medicaid? Should the state?
Accept the Medicaid
Yes,
expansion?
yes.
Yes,
Why?
absolutely.
Why?
By neglecting to accept it, we are overlooking the opportunity to insure thousands of more Wisconsinites. So currently, to apply to qualify for Medicaid, the ceiling is now lower. And by accepting that, the ceiling would be raised. So more individuals, so a lot more of our working class individuals would be able to qualify for Badger Care. And since we have not accepted the Medicaid expansion, we have a lot more people left uninsured that still do seek health care. And when that happens, then the health systems or the hospitals still treat these individuals, and to cover that cost, they raise the costs for everybody else.
I see.
And so it's really by neglecting to accept the federal funds, we have shifted the burden on the taxpayers and everyone else who does have health care.
Okay, let's go to a different subject.
Sure.
The impasse in the Capitol over how to pay for highways, bridges, construction, maintenance. It's important to your area.
Absolutely.
What's, if you could wave a wand, how would you pay for highways?
Well, I feel that it does come down to fiscal responsibility and looking at a sustainable solution. So at present, the last budget really looked at bonds, and so now we'll be looking at paying off our bonds instead of being able to move forward and paying for new roads. So a sustainable solution would have to be looking at newer sources of income. And the best thought to me is looking at the gas tax and keeping it, having it raised with inflation.
Bordering with Illinois, when tolls are suggested, how do you feel about that?
So I was born in the state line area and have spent a lot of time on Illinois roads, and if we could stay away from the toll option, I would advise it.
What a diplomatic answer. I admire that. Local governments have been dealing with levy limits to control property taxes for 14 years. Some local officials say this hurts their ability to provide local services. Mm-hmm. Keep levy limits, loosen them, get rid of them? Your thoughts?
So this does come down to an issue of local control, and looking back, a lot of communities had their own checks and balances in place to make sure that they would protect the folks in their communities from raising levies too high. So I am in favor of bolstering local control because I do not feel that the folks in Madison necessarily knows what's best for folks in Walworth County. Mm-hmm. So what works here in Madison may not be what's best for the community in Walworth County at the time.
The whole state is debating the Foxconn tax breaks and incentives, and now Kimberly-Clark wants similar tax breaks and incentives. What's your thought on how much help state government, state taxpayers should give private companies?
Again, I feel like this is an issue of fiscal responsibility, and the Foxconn deal is an irresponsible use of taxpayer dollars. So we as leaders, we should be looking to protect taxpayer dollars, investing locally, investing in small businesses, and I am not in favor of expanding these corporate handouts. So Foxconn was the largest corporate handout or corporate gift in essentially in Wisconsin's history.
Yes.
So I am much more in favor of, if we have $4.5 billion of money to invest in business for job growth, if we could divide that up amongst the assembly districts, we could provide 181 small businesses with $250,000 grants and for assistance. So if we have that type of funding to provide for businesses, I'd prefer not to give it to an international, multinational corporation, but to keep that in state.
The current state budget included a significant increase in state aid for our K-12 schools. When you talk to your school administrators and local school officials, do they say we need a similar big increase in the next state budget? What are you hearing?
At present, our school districts are remain underfunded. The fact of the matter is looking back in the past several budgets, funding from school was significantly decreased. So despite the recent increase in school funding, we're now back up to the funding level of 2011, and that does not even take into account inflation. So unfortunately, we're still not meeting our public school district's needs, and this is a very real and subject in Assembly District 31, as we had a school, the Darien Elementary School, closed and did not reopen this school year. So we have more and more school districts that, because of the decreased state funding, are having to turn to referendum, which I feel is unfair for the local communities and the taxpayers to have to make that decision. For some individuals who are on fixed incomes, raising the taxes could mean that it makes it more challenging for them to stay in their home. So why make them choose between our children and our future and this, when it's more the state's responsibility to be consistent with the school funding, so the schools don't have to grasp at straws, go look at referendums in order to keep their doors open.
The voucher program, the choice program, has been expanded Milwaukee to Racine and now statewide. What's your position on the voucher program?
So I feel that taxpayers deserve to know where their money is going. So when their money is going to what they think is public schools, but it's actually going to voucher programs, they deserve to know where their money is going. And I also am in favor of keeping more public dollars going towards public schools. I'm not against private schools or voucher schools, but I feel that public taxpayer dollars should be funneled back to where they were before.
There's going to be a debate over whether we need a new state prison. We have two that were built in the 1800s. Have you thought about that? Have you taken a position on that issue?
So yes, many of the prisons in our state are private, for-profit prisons, and I am not in favor of for-profit prison systems. I feel that we have to keep in mind safety. So safety is number one. So safety of our workers, safety of our inmates. So if similar to infrastructure and if our roads are crumbling, they need to be fixed. If our prison system or our prisons are not safe, then this needs to be addressed if it's a safety issue. But I'm not in favor of expanding our for-profit prison system.
Okay. Proposals in the Capitol to legalize both recreational and medical marijuana, your positions?
I am in, with respect to medicinal marijuana.
Medical marijuana.
Medical marijuana, yes. I am in favor of legalizing that in the state. As a healthcare provider, I work with individuals battling with chronic pain all the time, also folks going through cancer-related treatments, and there is a lot of research that supports the use of medical marijuana for these conditions and more. And especially when we're looking at and facing the current opioid crisis. This is an alternative therapy to that. Now, I'm a doctor of physical therapy,
Understand.
right? So the medicine I prescribe is exercise, but I do respect that this could be a very positive alternative for the state.
That's medical side. On the recreational side, are you not there yet?
I would need to look more at both sides before I would take a clear stance on that.
And final question, do you want to highlight differences between you and the incumbent that you're challenging on November 6th?
Yeah, so as you stated before, I'm a first-time candidate, and I'm going up against an 8-year incumbent. And the really exciting part here is that we are set up to win in November. So I was able to pull in over 49% of the vote in the primary, and Rebecca Dallett did win in Assembly District 31. So as I go out through the district and look at the doors, people want individuals who can lead, that are honest, they lead with integrity, they're not afraid to stand up against their party. And when I look at my opponent's voting record, she has votes 98 to 98% of the time straight with her party. So I feel that we need leaders that can stand up for what is right for the district and our communities, and I know that I am one that's able to do that.
Thank you. Brittany Keyes of Beloit is a Democratic candidate in Assembly District 31. The election is November 6th. Brittany, thank you for talking to Wisconsin Eye.
Thank you, Steve.
Thanks.
Campaign 2018 is sponsored by Wisconsin Hospital Association, Wisconsin Counties Association, Wisconsin Realtors Association, Marshfield Clinic Health System, AARP Wisconsin, and Campaign 2018 partner Milwaukee Journal Sentinel.